If anybody would have talked to me before 9/11 that you would be in the military or army, and I would have said you should have your head examined, because I'm the farthest away from anything like that. But then, of course, 9/11 happened, and I think everybody will agree that our life changed forever. And those were the times when all of us were sitting by the phone trying to call Red Cross or whatever we could do, anything. And one of those moments, I got connected with the Army, and here I volunteered at age 42 when I thought they really wouldn't know what to do with me, but I didn't realize that there was a need for the dentist, and I was glad to sign up. Tell me where to sign, and there I was. It did change my perspective on everything in multiple different ways. First of all, of course, when you go away from your family, and I was deployed to Iraq. Once you get over all that fact that you're leaving your practice, your family home, and then you concentrate on your work there, and then you realize you're dealing with these young people. They're same kind of people that I see in my practice, but they're doing so much more. And my appreciation for those young people was just, I can't even, there's no words for that. When you look at a young person who walks into my operatory there in Iraq because he's having a toothache and he's been flown in here, or he rode a Humvee coming on the dangerous roads just because he's having enough of a discomfort that he has to see a dentist. And it seems like you're doing your part in that, in the war itself. But to see those people, and then another thing that I noticed that really affected me, a lot of these young people were from middle of America, and a lot of them, young soldiers, had missing teeth, because when they signed up, a lot of times Army tried their best to get them ready for combat, and sometimes it means they can't fix this tooth in a hurry, they're going to take it out. So I saw a lot of it. We could not help with those missing teeth at that time, but as I think military made a promise, and when these people came back, they were helped through the VA system. But it made me realize that there is a big portion of middle America, middle class America, that still needs a lot of dental care that we as dental profession are still not providing it to them. And that actually was part of the reason for the plan also. Because here was something that we were offering to middle class that otherwise do not have the benefit of having a plan, having an insurance, but trying to get them so that I don't see another soldier with a missing tooth because it was so bad that we couldn't fix it, and that young man or young woman had to lose that tooth rather than fixing it. Dental insurance should not be the reason to go see the dentist or not see the dentist. You want to go see the dentist because you want a healthy body, healthy mouth.
I'm reasonably concerned because of sort of like the family history. And Dr. Pannu's always sort of tried to help me understand that, my parents' health isn't as great, their dental health isn't very good, and so I need to start as soon as possible, with a better foothold, with a successful plan. So that's sort of why I've taken the initiative to, get the dental coverage on my own.
If they do have dental coverage, I want them to use it, and whatever is needed, even if you cannot get all the treatment at one time or 1 year, there are ways that we can maximize the usage of that limited funds that insurance gives you. But secondly, let's suppose you're in that middle class that don't even have dental insurance or dental plan.
I'm 70 years old. I never had dental insurance. None of my jobs ever offered it. Anytime I had any insurance at all, none of it ever included dental.
In that case, I would say a little bit of prevention goes a long way. If you at the minimum, get 2 visits into the dentist where we are making sure that your teeth are healthy, your gums are healthy, and everything is good, that investment will go a long way. Let's suppose you say, you know what, I don't have dental plan, I don't have dental insurance, I'm going to wait until I find some, or I'm going to wait until I get $1,000 saved and then I'm going to go see the dentist. No. What if you go in for just a checkup, we do a cleaning, and let's suppose there is a small cavity, but you haven't gone in to get it checked. Within a year, 18 months, it's not going to be small anymore. Now it could be a bigger cavity, or on top of it, it could be a root canal. Now you're talking pain, and you're talking serious pain money-wise too. So I always believe a smaller problem, if found early enough, can be dealt with much easier. For that, our dental in-office dental plan is an option where you actually, yes, you do have to pay for the plan. It is not an insurance, but it does cover 2 cleanings, 2 exams, 2 oral cancer screenings in a year, and fluoride treatment for the kids. It's a preventive care plan. If you remember a few years ago when all these auto companies were going through a very hard time, one of the first things all these auto companies did, they dropped all of their retired auto workers from dental benefits. And all of a sudden I had all these huge amount of patients who were feeling so scared to come see me because they had no clue how they're going to take care of their preventive care. And that's when I came up with this idea that, listen, get your preventive care even if you don't have dental insurance. If you know up front, this is how much it's going to cost you in 1 year to take care of your mouth for 1 year. It gave them a peace of mind that, yes, if we go for our 2 visits in a year, we will still get our preventive care, and I know I can manage this much per year.
I like that it was condensed and just easy. This is what you get. This is how much it is. That it was cheaper than if you just did it separately, or if you had any dental work done that you got a discount. I was never comfortable with a dentist until I met Dr. Pannu.
I guess what I have is complete trust in Dr. Pannu that whatever needs to be done will be done, and she will inform me.
But then I started to offer it to other people who did not have dental insurance. I'm thinking, hey, if they thought it was such a great idea, I'll start offering it to people who don't have dental insurance, so that they feel comfortable, they feel they can manage this, they feel it's controllable, and they know ahead of time how much it's going to cost them.
It's convenient, it's affordable. The coverage it grants me is more than I need right now, luckily, because I've been keeping up on the regular cleanings and the regular appointments. I haven't needed any additional dental work done.
That I didn't have to worry about making an appointment. It was made for you, and it was one less thing I had to worry about. Otherwise, I was just making whatever I felt like. In this way, it was something that they made for you at the time you made the visit, and it was routine.
I don't have to think, well, I need to see the dentist every so many months, and I won't be able to because I don't have the money to pay for it.
It provides dental care that's a lot more affordable. I knew that if I made that payment and I was done for the year, it took care of my 2 cleanings and the x-ray, and it was all a consolidated price. I knew offhand what it was.
But it does offer, significant savings to me, as if I was to pay for the cleanings out of pocket, it would be a little bit more.
The plan actually covers the basic needs of any healthy mouth.
And since we started offering it to patients in general who didn't have dental insurance, I have found out people with young families, all of a sudden we offer them a family pack. You have 2 adults, 2 kids, you have another package. And then they look at it, they can't believe that for this much amount of money, they can have 2 visits a year for the whole family, and they know what the cost is going to be. And those are the biggest fans. But then I'm still seeing a lot of older people who simply do not have any kind of dental benefit from any other source, and they feel this is a plan which keeps them coming back for their biannual visits. But really, any person, single people, young people who just graduated from college, they're taking their first job, and most and more new jobs are not giving you any benefits. So anybody who thinks they can, they would like to go see the dentist but don't have the plan, this is for you.
After Dr. Pannu's assistant told me about it, I did call around to see if anybody else did, and to my knowledge, nobody else in the area was offering a policy.
She takes such good care of my teeth that I really don't feel I need dental insurance. Whatever the plan that I have with her takes care of everything adequately.
I think the peace of mind is more important than anything else is what I'm gaining.
It's very personable. It's almost to the point that I feel like all my patients are my family. They know about mine and I know about theirs. Anybody who walks in here, I know about their daughter, their mother who's been sick, who's been in the hospital. We just have that kind of environment just because it's a small place. I can, if you mention a name, chances are I'll know exactly, oh, so-and-so's brother is there and sister is there and that kind of stuff. That's the main difference to me.
I've been a patient of hers since her daughter and I were in preschool together. Well over 20 years.
The way I was approached, the way I was treated, the way everything was so professional, I feel very comfortable. I feel like somebody really cares for my health and don't look after my money. And it's still a true feeling about that.
If you feel comfortable, you will have good dental care. All of us as dentists are trained to provide dental care. It's just how much of a comfort level that me as a provider and you as a patient feel will really dictate what kind of care you have. That's why I think it's really important for you to feel comfortable if you are going to come to me. So for that reason, I suggest you pick up the phone, make a complimentary appointment. It'll be more like a meet and greet session. You will meet my staff, you will come and visit the office, and you will get to see if do I feel comfortable in this situation. And if you do, we will see you. And if you don't, so be it.